Thank you, Sophia. Hi, everyone. Firstly, thank you for joining in. It's nice to see a lot of familiar names out there. Firstly, I hope all of you are doing safe and healthy. All of you are keeping safe and healthy. Without further ado, I'll move on to the topic of the webinar. So we've realized that business leaders across industries are grappling with the effect of COVID-19 and trying to figure out what the future has in store. I'm sure all the attendees can relate to this in some form or the other. The objective of this webinar is to encourage dialogue and discussion among business leaders in the med devices space. The topic of the webinar is Recalibrating the Road Ahead for the Medical Devices Space. Along with the panelists and the moderator, we will be discussing this topic from the perspective of people, processes, and business. I would encourage all of our attendees to also participate by asking questions. Without further delay, I'll start off introducing our panel and myself. For those of you who don't know me, my name is Harit and I've been with Page for more than 3 years now. Having served across multiple functions within Michael Page, I currently head the healthcare and life sciences practice for the Gurgaon office. Moving on to the panel, our first panelist is Pavan. Pavan, as a lot of you might already know, is currently the MD India and South Asia with Becton Dickinson. Pavan comes with 25 plus years of experience with multiple sectors, including IT training, consumer electronics, home appliances, and healthcare. He has been with BD for the last 16 years and has served multiple stints across India, EMEA, US, and Singapore. Second, we have Shalini. Shalini is currently the Director HR at Baxter, where she is responsible for global R&D, IT, captive center, sales and manufacturing, having more than 5,000 employees in India. In total, Shalini comes with 24 plus years of HR experience with multiple sectors, including IT, ITES, retail, and healthcare. Then we have Shubhi on board with us. Shubhi is the General Manager for India and South Asia at Resmed. She comes with 22 plus years of multidisciplinary experience across the healthcare space, including medical devices, surgery, pharmaceuticals, biotechnology, biologics, excipients, H&N, and vaccines. And finally, we have Dr. Shankar. Dr. Shankar is currently the COO with Paras Group of Hospitals. He comes with 22 plus years of varied experience in working with reputed healthcare chains of India, such as Max Healthcare, Columbia Asia Hospitals, Fortis Healthcare, and currently associated with Paras Group, while managing different roles ranging from sales to strategy and operations. Today's webinar is going to be moderated by Ankit Agarwala. Ankit has been with the Page Group for over 10 years now, having served with multiple markets within the Page Group, including Singapore, Mumbai, and Gurgaon. Ankit is currently a regional director with us and heads the business for North and East part of India at Page. I will now hand it over to Ankit to take it forward from here. I hope you all enjoy the webinar. Over to you, Ankit.
Thank you, Harit, and good evening, everyone. Pleasure to be speaking to you today. We're going to be discussing the medical devices sector this evening and the calibrations and best practices which will enable an effective recovery from the COVID impact, as well as help organizations prosper in the new normal that we're going to see post-COVID. And during this discussion, we're going to touch upon aspects of business management, operational efficiencies, as well as people, with the strong and illustrious panel that we have today. So I think just to set some context, many of us would know, but India is now the fourth largest market for medical devices in Asia. And it's a sector which has been growing at a strong pace. And while every industry has had their struggles during the COVID outbreak, I think there are some unique challenges in the medical devices sector, given the proximity to hospitals and medical institutions. So just with that background and to kick things off, we're going to start with a poll question, which will hopefully warm all of you up and is also a practical paradox that many organizations in the sector are facing today. So over to you, Sophia, for the poll question.
No worries, Ankit. So all of you will see the poll questions pop up on your screen right now. The question is, how will you manage employees who may be hesitant to visit hospitals or customers for work, keeping in mind both employee comfort as well as business demand? So there are 4 options that you can choose from. Allow them to stay at home with normal pay and absorb the business impact. Second is to allow them to stay at home, but this time with reduced pay and absorb the business impact. Third option is to provide an option to take a long-term sabbatical and backfill the role with a new hire. And finally, allow limited flexibility for a few days and provide counseling or safety support, and then ask them to resume work and meet customers. So we'll leave it for a couple more seconds, just so we can get more of you voting, and then we'll close and share the results with everyone. I think we have a clear winner based on what I'm seeing at the moment. Perhaps the panelists will have an idea of what the most popular answer will be in their minds. All right, I'll close
Let's see it.
Sorry?
Let's see the results.
Right, so let me close that now and share that with everyone.
Yes,
so very
and I think,
strongly, yeah, 83%, right, with the final option of having limited flexibility.
yes, and I think that's not at all a surprising outcome over there. And I think with that backdrop, I can open the discussion with Pavan. Pavan, what do you see as the biggest changes in the way the med devices sector is going to view revenue generation and their target markets given the impact of COVID?
Hey, thank you, Ankit. Greetings to all. Wonderful to have you all. I see more than 135 people. So it's wonderful to get your view on. I thought I was an isolationist when I was looking at what the choice for that question will be, but I'm glad to see so many of us are of the same board. Ankit, it is actually, given the fact that it is going to be very unpredictable how this will pan out, if I want to look at some directions where this will happen, the first thing that you will have is what we call COVID market. Till recently, across industry that we see, Western developed worlds would have a spurt every winter called flu segment. And that would make a swing between good performance and super performance, because if you had a more flu, then everyone would benefit for playing in that, whether it's a diagnostic company, whether it is primary care physicians and the consumers. So now we can easily see COVID as one segment that would happen for a longer time. There would be probably diagnostic testing, all kinds of technologies. PPEs become one, probably an industry. Till now, they were probably never seen in healthcare in a big way. But the personal protective equipment will become bigger as a segment, whether for healthcare or non-healthcare. You would definitely see home care getting on to be a big one. With the telemedicine resistance people had, or the hospitals had a business model which didn't work very well with telemedicine. Now that is changing because patients are going to ask for telemedicine. So that is a segment, and what it means is, till now you had hospitals, diagnostics was a big revenue generator and defrayer of costs. If you're going to have telemedicine take over, what would you do to ensure you will cover that testing that used to be part of that? So probably you'll see hospitals investing in acquiring labs and having a segment created saying we would have our own diagnostic testing. That's one thing that I can foresee happening. Alternatively, specialized home care companies would come up, which would provide for a lot of these ancillary services and allow a patient who participates in telemedicine to get into diagnostic testing so that the treatment can be completed. Those are some ways where I can see segments opening up. And that would also mean companies, industry has to readjust how they go to market with that. Now, those are broadly areas where I can see today, probably 1 month later, I can see probably a little bit more.
And just to build upon what you said, Pavan, do you see that the existing medical devices companies will be able to broaden their product spectrums, or will be able to cope with these changes, or does it offer a market for new organizations? How do you see this ecosystem changing in the time to come?
A mixed bag, Ankit. There are companies which would probably have platforms with those technologies already in place, and they have to innovate specific to COVID, and that can sit on a platform, say a diagnostic company. You've seen Roche and Abbott come out with other companies. BD has got certain assets that can go on to the current equipment or a neutral equipment to diagnose testing. That's one. People who thought that ventilator business is not a great business may really invest in ventilator business because it's a big segment that is coming. Where I see innovation happening is in the care delivery models. You can definitely see a lot more innovation coming. Someone who is small with home diagnostics may suddenly find themselves in the middle of a great opportunity. By the time large core labs and hospitals react to this, they may be in the center of occupying a leadership space there. So it's a mixed one. Yes, some companies will take time to innovate, but there are some who have innovated, but they were finding very small markets suddenly. I'll just give you an example. You are a digital marketing company. There was so much resistance in India for people converting to digital. Suddenly everybody wants to be digital. So you're in the position to leverage that change in direction.
Okay, thank you for that, Pavan. And Shubhi, to bring you in and building on what we just discussed, do you see any changes in product strategy from companies or how they look at development of products or R&Ds and how they're going to invest people and effort in these areas? Do you see any significant changes happening in light of what we have just seen?
So I think, Ankit, you touched upon a very important point. I think medical devices, India is the fourth largest, as you said. And when we talk of medical devices, you're talking about plethora of solutions and services, whether it is hospital-centric, I mean, something which is catering to the needs of hospitals or doctors or sometimes patients, sometimes providing solutions for customer experience. Sometimes, there can be solutions which could be for ease of business. There could be solutions which are overall impacting, like telemedicine, like digital pathways and digital marketing to an extent. Everything has a role to play. For example, when you talk of the medical devices perspective and the industry at large. Now, when I look at like what Pavan was rightly mentioning, that some of us are positively impacted, and but most of the organizations are negatively impacted by the COVID, especially because of the revenue loss. If you are available or if you have adjacencies in those segments, possibly that you would maximize and you would positively impact your revenues, but the rest of it will suffer. Now, short term or long term can be anybody's perspective, but if it's a short term, then you know that you don't have to change much. You just have to wait and watch, try to do some changes in your mix and in your offerings for temporary basis. But if you're unfortunately in a non-essential or a category which is going to get long-term impacted, when I say long-term, to the effect of not 1 or 2 quarters, but maybe possibly to come to normal would take you about 1 to 2 years, then probably, it is time that you start looking at your portfolio, your product, your segments, everything very differently. We did the same, and I'm sure many others are trying to do the same. So when we look at and as an organization, I'm not just talking about the company that I represent, but I think it's relevant for everyone. One has to look at what are the core therapies you're working on. I mean, you can't change your core just because COVID happened, and even if it's going to impact you for about 1 or 2 quarters, or maybe worst case 1 year, but you can always look at the adjacencies that you are in, the first level adjacencies and the second level adjacencies, and look at both your product offerings, the segments that you're in. Third is your access and geographical reach. And fourth, I believe, is also the fact that many of your offerings and many of your areas that you operate in will get impacted by the pressures on the payment systems, whether it is the government which is paying you or whether it is the customer which is paying you. So affordability and the payment mechanisms will play a major role. So given all these scheme of things, perhaps it is right for organizations to start looking at which are those key segments and which are those products. If you have a wide portfolio, which are those portfolios that you will focus your attention on for the first 1 or 2 quarters, and then going forward for the next 1 year, and make necessary changes. Those companies who can make those changes, those swift changes early on, I think those will have I think a decent runway. The others probably will have to think through as to what to do in the long term.
Yeah, and you mentioned a very, very interesting point about adjacencies which exist and how they can be made use of, Shubhi. So maybe asking the same question from a different and a more interesting angle. What kind of organizations do you think are best placed right now to leverage the opportunity that exists in the market and maybe surge ahead of their peer organizations?
I personally feel those organizations which are able to provide, as Pavan was mentioning, home care solutions, point of care solutions, I would say, virtual pathways, low touch models, whether it is in diagnostics, whether it is in deliveries, whether it is in terms of solutions, or even from the perspective of services and functions, from marketing. Or supply chain. I think those are the areas, those organizations which are into those adjacencies will do better than others, I feel.
Understood. Thank you so much, Shubhi. Some very good insights over there. And, I'm going to take the opportunity to touch upon a slightly different aspect of the period we've seen recently, which is the impact on employees and how they've been working in the sector. And I'll bring in Shalini into this point. So, Shalini, what do you think have been some of the learnings in terms of alternate or more efficient ways of working, that we've been forced to adopt in the last couple of months?
So Ankit, it has been really unprecedented times, really uncharted territories. And so newer ways of thinking is what is required. There has to be a paradigm shift in the way we have approached our talent in the past. So the new skills, and especially when we talk about the medical devices sector, it has heavily, kind of believed in the technological prowess that we have. I think it's time that the future will belong to not only technical prowess, but also customer service orientation, whether it is digital or whether it is, reaching out to people. So one of the key things that we have in our portfolio is the hemodialysis service and the peritoneal dialysis service. Surprisingly, the peritoneal dialysis will have a larger market post-COVID because people are very scared to go to hospitals. And so the transition from, HD to PD is a far better future for patients, for doctors, for hospitals. So I think when we start to look at what is the kind of talent we will require technological prowess, plus we will also require a larger customer orientation. That's the kind of talent that we would require. The second realization that COVID has brought us is the fact that over a period of time, our efficiencies get reduced. The efficiencies get reduced in the system, because of which the productivity diminishes and the revenue per employee starts to diminish in the longer term. Now this happens because we start to introduce multi-layered decision making. We start to have multiple systems and processes which have no longer, are required, or they have stopped benefiting the way they should when they were initiated. And we continue to add larger processes. And so to manage these larger processes and multi-layered decision making, we need larger set of people. We need larger number of people. And so over a period of time, we have a huge task force or a huge workforce. And so the productivity or the revenue per person kind of goes down. So I think it's a time to pause and reflect and reevaluate these key things, whether it is the way we have put in our systems and processes. So a little business process re-engineering is required. And also the decision-making matrices should be relooked at to make the organization more agile and to look at increasing the people capability. This will help us to bring about our focus back to revenue per employee, and so the success of the organization in the long run.
Yeah, very interesting, Shalini. I mean, you mentioned about a forced purging of many of the rules that we've built up over the years, but perhaps some of them don't have the same edge to them anymore, but are just lying there. And you also touched upon the aspect of productivity and, how much are we actually generating per employee, and how can we sharpen that as well? So maybe if I look at it from an employee perspective in the medical devices arena today, you touched upon customer service as being one of the keys. Are there any other things I need to start thinking about very, very proactively as an employee in this sector to be very successful?
Yeah, I think agility is one and resilience is the other one. So for leaders, agility and perseverance is what will carve the way forward. It's really important because we don't know whether there is a COVID-20 lying there or a COVID-21 lying in there. What will help us is to be more agile, to create agile teams, agile organizations, be resilient, turn around the situation for everybody to see the positive side. And today's leaders will need to be doing and showcasing that the vision and the path forward is very, very clear, because we'll all have to adapt.
Understand. And just another follow-up question from what you mentioned earlier about the customer centricity. How well developed do you think, Shalini, today are the matrices in the companies which measure the performance on customer centricity? Are these well developed, or do they require a big change today?
I think it requires a mind shift, because we've never worked on saying what is customer centricity all about. How do we measure it? What is the net promoter score of a call? How do we make sure that each and every call that our SM is making, or the salesperson is making, what is the return on investment? We sometimes get stuck into the numerics of saying that these many calls per doctor or your KOLs will it, but is it translating into real results is what we need to start focusing on. So the input versus the output is what we need to focus on.
Okay, thank you for that, Shalini. And I think we've been talking a lot about customer centricity, so it's the best time to bring in the customer on the panel, Dr. Shankar. And Dr. Shankar, of course, is in a great position to provide the end client perspective a little bit as well. So I'll just open it with you, Dr. Shankar. Hospitals are obviously under a lot of stress right now with what is going on out there. What are your expectations from med devices companies during this period to make your life easier?
Greetings and good evening to everyone. Ankit, I would like to just build a small background before I get on to the question directly. So let's look at the lockdowns, and if we divide them into, let's say, 3 phases, maybe dividing into 3 weeks now. So how, and it's a big dilemma right now. It's a pandemic, it's a health crisis, healthcare crisis, and all of us are talking about businesses going down. So that's the biggest dilemma which we are facing right now. So if we see, if I take the first 3-4 weeks of lockdown, the occupancies and the footfalls in the hospitals were down almost by 70% to 80%, and some hospitals completely going zero occupancies and things like that. Little bit things started improving after around 3 to 4 weeks. The footfalls started coming in, the patients started coming in, emergencies started coming back in. Just to give you a small example, we used to have almost 10 patients of pain abdomen every day coming in our emergency, which went down to 1 patient. So whether these disappeared pain abdomens got cured by sitting at home, or people were not willing to come to the hospital, is the bigger question. So similarly, if we take the last 3 weeks of the lockdown or last 2 weeks of the lockdown, the footfalls have just doubled up. The occupancies have started coming up. There has been a lot of, I would say, healthcare demand coming back in. But still there is a big scare in the mind of the patients or of the people walking into the hospital. Are hospitals safe or not? So that is something which is right now a big concern. So looking at this concern and talking about it, whether the hospitals are safe zone or hospitals are hotspots, whether the healthcare workers are safe or healthcare workers are one of the biggest transmitter of the disease. So these are the 2 big concerns which we as healthcare service delivery providers are grappling with. and some of the points which have been already touched by other panelists is how to make sure that, so I would first again categorize into two different categories of patient. Those who can avoid coming to the hospitals can be helped by different IT solutions, maybe Pavan was talking about teleconsults, maybe some point of care diagnostics at home, like glucose monitoring systems or something of that sort, or maybe providing some services like home pickup of samples, drop of medicines, prescription refills at homes, and all those things. But there is a second category which is very important, and which is you can't avoid being out of hospitals. A lot of elective surgeries which have been pending in last 2 months now needs to be done. A lot of other work which was getting delayed because of this COVID situation needs to be done. So here I feel the role of medical device industry, how it can be supporting in hospitals doing this is comes over here. So what we as hospitals or healthcare delivery providers expect is maybe some innovations. Pavan talked about some innovations and maybe some collaborations. So just to give you a small perspective, in our day-to-day life, we all keep innovating a lot of things, but these innovations most of the times get missed. There is no one, or we are so busy in our jobs that we keep missing these innovations on a daily life. Even let's say if there is a queue at the billing section, there are billing executives who keep innovating, or the coordinators who keep innovating how to reduce the queue. But these innovations get lost in the daily struggle and the daily business of the work and all those things. So this is the time when we need to pick up these innovations, when we need to collaborate with the medical devices industry and come up with solutions which are sustainable, which are maybe can be used in all the hospitals and can be made. And these are able to turn around the fast end of the day, ensuring that the patient feels or the attendants feel safe coming to the hospital. I'll just give you a small example over here. So we use oxygen hoods for our neonates, the small babies who are born, to deliver oxygen. So why can't we come and innovate something, a hood, similar hood for patients who are highly infectious and can prevent maybe the healthcare service provider, anesthetist, or a critical care specialist giving him maybe some immediate procedure or care in that way. So we need to innovate, we need to do it fast, we need to collaborate on that with the medical devices industries, we need to be on the ground with the healthcare delivery personnel to make sure these innovations happen fast. So that's first thing which I believe we can do quickly, which can give a lot of confidence and assurances to the delivery providers also, that yes, that's where the partnerships can come in and play and maybe help in providing more safe atmosphere for the patients and so as well as the healthcare service providers. This is
yes, please carry on.
So this is one which is immediate, and in long term, what I feel is we need to look at some of the designing aspects in healthcare. So that's where again industry can come in help. So though we have been reading and listening that these kind of pandemics come in once in 100 years, so once in century. It was 17, 20, 18, 20, 19, 20, and 2020 now. So, but how can we ensure that we do some designing in healthcare infrastructure, whether it is equipment related, whether it is space related, whether it is different setups, whether it's a OPD setup or a ER setup or a ICU setup or a OT setup, coming up with some designs where we ensure that the safety of the healthcare worker and the patient is ensured, and we are able to reduce this cross contamination of each other.
Yeah.
So that's where I expect these things to happen. Yeah.
Yeah, I think very, very relevant points, Dr. Shankar. And, you highlight the innovation which is needed, especially towards increasing safety. And I also saw Pavan nodding while you were mentioning that. So maybe I'll get a quick reaction from Pavan in terms of whether this resonates with the kind of thought process that has been going on at BD or otherwise in the industry.
Definitely agree with Dr. Shankar. At the end of the day, they are the ones who are delivering the care to the patient, and it will change, especially the virulence with which this can transmit has been different, and it spread a lot. Ebola is probably more viral and more dangerous, but it was very much a contained one. Whereas this is something that is happening in developed markets and emerging markets where travel is impossible to stop, and therefore we have to innovate. I'm with Dr. Shankar. But the reality for medtech device industry or a drug industry is that it's a very long product development cycle. So you cannot churn something out today because you saw something happening today. You can repurpose, get an emergency use access, but what this will do, and COVID is not going away tomorrow. So one good thing is that people would look at what are the evolving mechanisms that are happening. So what you're talking about, currently ventilators are a capacity. They may be a better designed ventilator, portable ventilator, multiple people on one ventilator, and what technologies we need to do. So that's one vector. If home care is going to happen, you cannot have standard way of you delivered care or how devices were delivered. You need a different kind of solutions which will amenable to a lesser skilled worker or a mobile worker or a mobile ambulance which can deliver these care. So there will be, and that is the collaboration that will happen. But you don't have to think that it will only happen 5 years out or 6 years out. If we look at our journey in the last 60 days, for the first 15 days, everyone in the country spoke only two words, PPE and ventilator. As if you had this, you actually licked the disease. Then we had to actually talk about how infection prevention is a bigger one. Critical care delivery is the next big one. How do you keep your healthcare workers safe so that, the only vision I had in front of me is what happened to Botswana, Lesotho land, Swaziland, all these places when they were battling HIV. The entire healthcare community got wiped out in contracting that disease. So the bigger worry was, how do you engineer devices and technologies which will first save healthcare workers so that somebody is there to care for the patient. Yeah. And all I thought about COVID was that we had to work with different industry leaders, KOLs, to say, can we expand this beyond PPE and ventilator? Because that's only for 5% of the population.
Yeah.
If you have a patient walking in, how do you ensure that you stay safe and you don't contaminate? We realize that it is shedding in blood. You want to deal with urine management. You want to deal with medication delivery. You want to deal with queuing. There's so many other aspects that we have to rework. So I completely agree with Dr. Shankar that there's a lot more collaboration that you have to happen. Who would upgrade the knowledge levels of the healthcare workers? The doctors are busy trying to figure out what protocol to have. Who would help nurse? Who will actually going to figure out what? So there are many areas where the industry can collaborate. We're collaborating with many companies which are pitching in and working on. Yeah. But at the same time, this is a 5-6 year journey where we will probably get all our arms around this.
Yep. Thank you. Thank you for that, Pavan. And maybe I'll hop over to Shubhi now with something that is often seen at the opposite spectrum of innovation, which is cost efficiencies, and improvements in operational efficiencies as well. So, Shubhi, where do you think are the biggest opportunities today for improvements in operations and cost efficiencies, given, of course, the COVID climate and also the road ahead?
Thank you, Ankit, for that. I think the need of the hour, and I think Dr. Shankar can also talk about that, and please feel free to add on after I speak. I think the need of the hour is that our operations both and supply chain both have to be very, very nimble and agile. I think agile is the word, but I think at this moment, they also have to be very, very nimble. Especially, if I try to recollect the times when things were moving on and we were deciding for work from home, which included people, who were involved in logistics and support functions as well. to the time when suddenly lockdown was announced. For most of the companies that we are talking about, especially in the medical device sector, I think 80% to 85% of the products are still imported. I think very little, 15 to 20%. With all the indigenous push over the last couple of years, we still have not reached more than 20% of total indigenization. So when these things were going on one hand, we had an issue of making sure that our warehouses, first we get the products, if for example, if there were segments that we could sell, and thankfully Resmed will, has a category which has some ventilators for COVID patients as well. So worldwide, we were struggling as to get patients, get the life-saving devices on one hand. On the other hand, we were trying to make sure that they got custom cleared in time. Third, they reached our warehouse, and then once after reaching warehouse, make sure that there are people who can do billing and also repackage and also make them available to the customers in need, and in these cases mostly government authorities. In such a situation, if you don't have a very agile and think on feet kind of operational system, and I'm not just talking about the operational supply chain team here, I think your entire organization had to line up in that on that thought process. And frankly, if you ask me, we actually diluted all our core responsibilities in terms of this is your job or this is my accountability. We actually came together, especially we designed a core team which would address from forecasting to supply chain to operations, and make sure that the business continuity is not impacted. Coming to your question of cost efficiency, I think never ever have the need for digitization and automation being that strong as is today. I think most of the organization have been thinking years and have been very hesitant in terms of adopting some of those practices. However, I think COVID kind of precipitated everything. There were some projects that we really wanted to imbibe, and we knew that if we have to take them on, they probably would take about 6-8 months time. But believe you me not, we actually implemented some of those projects in less than a month's time during this phase. Right. Yeah. So sometimes these situations are out of ordinary, but also help us in delivering extraordinary results. I think the key point here is when it comes to your operational processes, you need to make sure that your organization is open, agile, adaptable, can think, can be creative, and can also partner with providers. I'm talking about service providers in these cases, who are also very innovative. If you are nimble, but your partner is not nimble, then it's actually no good. So you have to also, this also made us go back to the drawing board as to, what, if your plan A works well in the normal situation, you need to have your plan B. And you also, along with your plan B, you need to have at least 1 or 2 vendors and partners who can actually act on plan B along with you. Right? Yeah. So I think these are some of the thoughts I would put forward, and feel free, other panelists, to add.
Yes. And I think a couple of points stood out for me, Shubhi, that you mentioned. I mean, you mentioned agility, of course, and you also touched upon the supply chains, and I think that's an entire area of discussion as well. So I'll probably first go over to Pavan with the supply chain, and then I'll come to Shalini with more of the agility of organizations towards employees. But Pavan, there have been many changes, and many changes are foreseen in the global supply chains post-COVID. Do you see any shifts in manufacturing and supply chain in the devices sector?
Yes and no answer. If you're expecting disruption and people queuing up to come into India and put up a supply chain, as I say, supply chain, it's integrated supply chain. You have an operation set up, delivery centers or regional warehouses. I would say probably no. But if you are looking at next 3 to 5 years, companies planning, saying, what is maximum consumed in this market? And can I get a better planning protection for disruptions of 3 to 6 months? Yes, you would see that. So investments for manufacturing will not fly out of a geography A and come here because the two conditions why someone would want to invest, especially multinational mindset. A, the local market is very attractive and demand is extremely high that you want to participate and eliminate a lot of costs. Alternatively, it is the best cost destination among various investment destinations that you have, that you can make here and send it global. On both counts, India is not hot at this point. You know, the directions you get in India is, if you're in healthcare and you want to make money, it's very bad. Which means everybody is worried, when will the price caps happen? When will the government start dictating what margins you can have? And then, you know, regulatory changes, policy changes. So there is a lot of uncertainty of, if you put $1, can you take anything out? And can you take it out cleanly without being defensive? India doesn't have the affinity for insurance and insurance penetration. That means what you can give as innovation and get some value is very minimal. Everybody wants to have low cost because patient can't pay. If you look at the other side, which is this the best destination? No. You have to take 31 ministries or 32 ministries before you can get to med device manufacturing in India.
Still that's the case?
Yes. Yes.
Okay.
You're not even governed by one ministry. We have 6 ministries probably battling right now who will govern who. You know, one regulatory function, there are 2 different parts of government which are battling who will govern medical devices. So there is absolutely nothing that is guaranteed to you that if you invest in India, it's a low cost or better cost destination. So therefore, longer run, if you want to be attractive, there are other fundamental structural things that we need to do, not just because there's a COVID scare that has happened.
Okay. So, you know, that whole point which has been in the media recently about trying to bring manufacturing from China to India is still a while away for the devices sector, it's safe to say.
I want to really agree to you with most polite respect.
Okay. All right. Thank you for that, Pavan. And, you know, on that note, I'll just step into, you know, a related and a slightly different area, which is how agile have organizations been towards their employees, and, you know, what have they done, you know, to keep their morale high, etc. And just before I give it over to you, Shalini, I think we also have a poll which is in this direction, Sophia. So can we bring that up, please?
No problem. So the second question that we have is, how satisfied are you with your company's handling of employees during COVID-19? So let us know, is that very satisfied, neutral, disappointed, or very disappointed? So a side note as well, we've started receiving a lot of questions, and that's great to see. Thank you all so much for submitting your questions. We have about 26 live questions now. So I would just ask, you know, if you haven't submitted one, feel free to look through the list and give a thumbs up to any questions that resonate with you, because we already have a lot. We may not be able to get through all of them. So help us to identify which are the questions that most of you want answered, so we can get through those and at least cover the top 4 or 5. Yeah, so have a look at the questions list and then give a thumbs up accordingly. All right, I think most of you have voted, so I will end the polling now and we can share the results. Pretty encouraging, I would say. 44% at very satisfied, 27 satisfied, and then the disappointed range is about 14% total. What do you guys think as panelists? Quite reassuring, I guess.
Yes, thank you, Sophia. It is. And, you know, on that note, I'll just put this question up to you, Shalini. You know, what have organizations been doing in this period, and any specifics on medical devices organizations are welcome, to keep their employees engaged, to keep the morale high, and to keep them productive?
Yeah, so I think these were very baffling times for all of us as leaders, as employees. And, you know, initially, when we started, we did not know whether it was a short term, whether it was a longer term. We were looking at a few weeks, or whether we were looking at months. So having said that, what kept, you know, the organization and the employees very engaged was, one was keep the employees focused on the vision. What are we trying to achieve in the longer term? And the second one was the culture, which was kept really intact. Now, these two things were done by communication, very strong and consistent communication from the leader's desk. So whether it was from the CEOs of the organization, or whether it was from the business leaders, or whether it was from HR leaders, we have seen continuous communication from the leaders, not only talking about, that the future is going to be very uncertain, but also talking about their own learning and how are they adapting to these situations. So a little bit of vulnerability was good to get connected to our employees. So that was something which actually helped in consistently communicating and keeping employees motivated, that we are all sailing through the same difficult times and we are all adapting, we are all learning. The second was, some of the organizations have done really candid conversations with their employees, speaking about the challenges that are going to be there, and then urging the employees to think out of the box, to innovate, even innovate on the small processes and systems that they were looking at. The smaller things that they were handling, because they were closer to those processes. They could actually tell us what could be innovated to bring in more efficiencies into the system. The second thing that we did was to build the emotional connect. So that was really important, to bring the employees outside of work. So we started to have certain discussions and chat sessions with employees which did not discuss work. We discussed some personal aspects. We brought in families into that, those chat sessions, so that people feel that, this is something which is more moving to emotional quotient, building that emotional connect with the organization. The third thing that organizations have been doing is to support the employees, maybe enhancing their employee insurances, enhancing the employee assistance, practicalities. So people were going through mental stress. So having organized sessions, how do you manage stress? How do you handle these mental stress during these times of COVID? How do you manage your, the work-life balance during these times of COVID? So this was just helping them, kind of adapt to the situation. We also started to work on making sure that people take off during work from home, because work from home was actually proving to be so difficult that there were no boundaries between personal and professional life. So as leaders, we started to encourage that please take off. And this is the time that you need not attend any calls, you need not attend to, the other business things, and you could also, delegate it to your teams. So these are some of the things that the organizations have been doing to make sure that the employees are motivated. They are able to deal with this uncertainty, which all of us really don't know when is it going to end.
Yeah,
so these
thank
are
you.
some of the things that we.
Yeah, very interesting insights, Shalini, and thank you to all the panelists for those insights so far. There is one final area of discussion I want to cover in the interest of time, and that's the recovery and the road ahead from here. And I want to come to Dr. Shankar first on that, but before that, we also have our last poll question, which is sort of focused towards the area of how soon we see things recovering. So, Sophia, can we have our third poll question up there as well?
Sure. So the final poll question we have is around, given the current scenario, when do you feel medical device sales will move back to normality? That's 3 months, 6 months, 12 months, or 24 months? Can we vote now? Okay, I'll close it in about another 5 to 8 seconds or so. So vote if you haven't. All right, I'll close the poll now. Thank you all who have voted. And here are the results. So 57% of you estimate that it's going to take about 6 months, so midterm, and then 28% say 12 months.
Thank you, Sophia, and interesting feedback there. So I think most of the audience feel that it's a midterm sort of expectation for sales to start getting back to normal, and we understand there are a lot of challenges in the way. So I just wanted to throw this up to you, Dr. Shankar. What roles do you think hospitals can play right now to get people to come back, especially the non-COVID stakeholders to come back to the hospitals as fast as possible and, start getting the sector to some degree of normalcy? what can the hospitals do in this regard?
So, Ankit, like I talked earlier also, it's more about generating confidence and giving confidence to the people that hospitals are safe place, not hotspots.
Yeah.
Healthcare workers are, I read an article a few days back in a newspaper where it said that whether healthcare workers are one of the biggest transmitters. So we have to give that confidence that no, healthcare workers, doctors, nurses, technicians are not the transmitters for the disease. So that is something which needs to be, I would say, said about, talked about on a daily basis. But the way situation has been unfolding in last 1 week in India, the way the numbers have started already going closer to 10,000 per day, and we expect it to be further more increasing in next few days. Hospitals are going to be a difficult place to be in. Healthcare workers in India are getting more and more infected. We need to take care of that. And like Pavan also mentioned a few minutes back, anytime and every time any new infection comes in, it leads to an increased healthcare cost. So let's talk about HIV, hepatitis B, hepatitis C. As and when they came in, they left the cost increasing. Now it has become a routine panel test before surgeries or even blood transfusions. And as COVID is going to remain, so it's also going to become one of the regular features, I would say, as a pre-surgery requirement, or maybe a lot of pre-other hospitalization requirements. So we will have to be careful about the costs. We will have to be very mindful. We all know that 60 to 70% of healthcare expenditure in India is out of pocket. We have still very less insurance penetration as compared to some of the other developed nations. So that's something which hospitals have to be very mindful of, and that's where the partnerships with the medical devices industry will come in to ensure that these costs are taken care of. End of the day, it all comes through the pockets of the patients. We all know that, we all realize that. So we will have to make sure that these things are taken care of, and we are able to develop some technologies which are maybe cost effective, or maybe which can be put in sooner than later. Second thing, most important, which Pavan also touched about, was talking about new technologies. And so CMEs and CNEs, continuous medical education and continuous nursing educations, have been a big part where industry has been a big partner and supporter always. And these new technologies, new innovations, new devices are taught. So we will have to find out ways and means to ensure that these knowledge is still imparted on a regular basis, and find out ways and means that how it can be done without having. So earlier it used to be in more in one-to-one, or maybe in more personal settings. So we will have to work out ways and means to see that how they can be done in non-personal settings, and these technologies are shared with maybe the upcoming young doctors and young nurses, and they can be trained more and more on this. So these are the two big thoughts in my mind right now.
Okay, and thank you for those great inputs, Dr. Shankar. I just want to circle back to first Pavan and then Shalini on this. Obviously there's a balance right now between employee safety and business recovery. Obviously both are important. So, what would you recommend as the best way forward to slowly getting back to the normal level of business that we were seeing? Obviously assuming the market will come back in due course. From an organization standpoint, Pavan, what do you see as the best way forward from here?
Hard one. I don't have one sunrises in the east answer. What I can say is these are some of the thoughts we are implementing in our approach. What I have learned over the 60 days is that it's like a funnel with a very narrow tip. If we unclogged the funnel first with government on movement of essential services, transport, allow me to open my warehouse, allow me to import, let's get. What we have not worked on as a country, and that is very clear, is get the patient who needed healthcare to the hospital. And that's where it is getting blocked right now. So Dr. Shankar can do hundreds of things, I can do hundreds of things, everything, unless we get the patient's confidence that they will get their healthcare and they are doing more damage if they stay at home. That's the first one. So I'm keen on collaborating with the industry. We're working, so I'll be talking to industry bodies to work with our providers to say, hey, can we all get one standard conversation going for a patient to say, we will treat you if you come to our hospital. We won't push you back. We won't ask you, do this or do that or go here or go here. That's one of the biggest pain right now. You look at all bad press we are getting from healthcare. It is about a patient going 7 hospitals before dying.
Yeah.
And it just says that, okay, if I go to hospital A, they're going to send me back and I have to find out to hospital B. If we have a unified protocol and we publicize that, saying, you come to a hospital, you have to get tested. This is what government's protocol is and we will do, and we will treat you. That's probably a confidence builder, and there is everyone's role in that. From an organization perspective, it is not possible for me to say, it's okay, sit at home, we will see when the healthcare recovers. We are a private entity, for-profit company, we can't manage this. Which means we have to encourage people to be confident of getting into a hospital. I might come across as Neanderthal, but this is my principle is, you chose to work in healthcare knowing all the risks of getting into a hospital or a lab when you work. We chose this profession. We are in healthcare not because it is only money, because we are also passionate about it. Whether you are a doctor, healthcare nurse, healthcare provider, or an employee. I'm not here. I sold electronics, I sold home appliances, but I found my home in healthcare. So there is a risk in working in healthcare. You've got to live with it. What can, as an organization, I make ecosystem? Can I get you PPE so that you don't spend out of your income? Can I ensure that if you have old parents or you have infants at your home, how can I facilitate that you don't go and expose yourself and your family at risk? I can create those flexibilities, but you got to get out and work. Why do I come to office? Is that messaging for my employees? If I'm wanting to ask my salesperson to work in the field and take a chance, and I want to work out of home because I'm scared of coming out, it's not going to work. So I want to lead that, and I get my leadership team to work out of office because this is how we kickstart. Everybody is waiting for the next person to come out and start. What can we do to create the ecosystem? That's my mindset.
Yeah.
And how can I encourage people to take this work and go forward? That's what we signed up for.
Yep. And that's some inspiring words over there. Shalini, do you also have a perspective on this in terms of, what is the way back for us keeping both employee safety and fast business recovery in mind?
Yeah, I think we should stay focused on what are we going to achieve in the longer term. And we should not take measures which will be short-term focused and then maybe compromising our long-term vision and the mission. So having said that, I completely agree with Pavan saying that we need to bring back people in. And so a lot of confidence building is required. And to build that confidence, a lot of paraphernalia or the ecosystem is required. So whether if we are sending our people into hospitals, our hospitals are safe enough or not, our people are carrying the PPEs or not, and just educating them around it. Also trying to help them to say, is there an alternate way of doing your business or getting the business, back on track? What can you do? So we could look at probably a different kind of incentivizing process, policies or systems to say, whenever we come back full-fledged, what different ways will you think to recover or help the business to recover? So those would be my 2 bits, on this bit on saying, getting employees back because business has to come back, and it has to be sustainable.
And Ankit, if I can,
yes, please. Yes, Shubhi.
I think both Pavan and Shalini put in very, very relevant points. Employee and their safety is paramount and comes first at any given point of time. But at the same time, business recovery and business continuity, whether in 3 months time or 6 months time is a priority for all businesses. And I think my approach has been the same on this, that while I allow, I'm sure this is relevant for many companies which are fairly active in this space, but for most of our organizations like ours and many others which are both in other categories but also in ventilators, many of my team members have been very, very active, whether it is demos, whether it is installations of ventilators, or whether it is hand-holding or training of the actual users. I think the message has been very, very clear that, you know, you have to make sure that you are comfortable first. Your safety is important. At the same time, you have to be innovative and creative about how do you make sure that the work continues on. Whether it is using your partners and making sure that they are wearing PPE kits, or you're wearing PPE kits, and making sure if you're doing installations, you're not doing installations in a active COVID center. You're doing in a storeroom or an outside area, so that you feel safe and your family at the back also is feeling safe that the person is out in the field. I think more importantly than just doing just getting people back onto the street, I think my approach and my push has been finding creative and innovative ways. Zoom and webinars have been such a great way of, we never probably thought that we would do such productive work previously. But today I'm encouraging my team to not just do appointments and face-to-face meetings on phones and WhatsApp, but also on Zooms and webinars. That why can't you actually book meeting and appointments like you used to do on Salesforce, otherwise in person, but you do now on WebEx and on Zoom. And while these are early days, and I think only time will tell how much are they successful, but I think these are experiments which will fall well in place going forward. Yeah. Same holds true for, we did a launch of 2 of our ventilators today, product launch on webinar today. Right, so
that's fantastic.
I think it's about,
congratulations.
It is about finding creative ways of doing things.
Great. Thanks for those inputs, Shubhi. I think we can carry the discussion on, but we are a little bit tight on time as well. So there's one final question, perhaps, which I'll address to Dr. Shankar. Again, this is related to the road to recovery. Dr. Shankar, what do you see the impact in terms of the longer term demand or need for medical products or medical devices, number one? And number two, is there a pent up need or a demand right now which will suddenly spike after things recover?
So yes, the demands have changed a little bit in the last few days. Like we all know, I had in my last few years of healthcare experience hardly seen doctors and anybody wearing PPE and roaming around in the hospitals. Things have changed now. We see people moving in PPEs, even normal surgeries, doctors are donning PPEs and taking extra precautions and all those things. I can give my example. I don't remember in last 18 years, I would have finished 2 bottles of alcohol scrubs, which I've done in last 60 days in my office. So that's how things are changing. So
I think you speak for a few people over there, Dr. Shankar.
Sorry?
I said you speak for a few people over there.
So if I see there has been a gradual shift towards more using the safety, not a gradual immediate shift on using more of the safety precautionary products and maybe more of hospital cleaning solutions. In the meantime, we have seen some new products also coming in more from cleaning solutions point of view, which is great and which is very welcome as of now, right now. There are a lot of practices changing from the hospital infection control perspective. Whether it is with the design of the hospitals, the air conditioning, or maybe it's with the cleaning practices, maybe it's with the even in a OPD setup, how the doctor is managing a patient and how the doctor is talking to a patient and examining patient. So a lot of changes happening that will definitely lead to a lot of changes. Our gloves, which we used to use, let's say, have doubled up in consumption in last couple of months. So things are changing. Like ventilators, this is something which is very, I would say, transitory. COVID is going to stay, but not that amount it will be going forward. Yes, we will be back. Like I stated in my first statement only, that things have started coming back in. So people have started coming in OPDs, people have started coming back in ER, people have started, some of the elective surgeries have started. There are few specialties which never stopped. So like obstetrics, deliveries kept happening, never stopped. Onco patient, onco treatments kept going on, never stopped. So their demands remain, I would say, at the same level.
Yeah.
But yes, with the times to go ahead, I think another couple of months where we would see a heavy rush of COVID. But after that, things are going to normalize in healthcare. With a change, we will become more preventive. We will become more cautious. End of the day, everything will lead to a cost to the patient, which we need to take care of.
Yeah, points noted, and very good insights. And I think we all hope that the road to recovery is fast and smooth. So thank you everyone for your inputs. We have a lot of questions which have come in already. I see more than 40 questions, but we only have about 20 odd minutes, so we'll do our best to answer as many of them as possible. So I'll try and start with some of the more popular questions that I can see right now, and perhaps I can address the first one to Shubhi. Shubhi, there's a question from an anonymous attendee which says that with the PM promoting his vocal for local policy, what do you think the implications would be for the med devices space, given the fact that this sector is majorly imports driven?
I think it's a very relevant question. I think I'm a proud Indian, and I would like my country to be as much capable of indigenous, I would say, independence, even on medical devices perspective. But I think there's a lot of gap between what we aspire versus what stage we are in. Even some of the countries, I'll take another example. I would go, build it the other way around. The fact that we sometimes see that so while medical devices is fairly strong as an industry in US, in Western Europe side, the other area that we really find medical devices, becoming stronger is China, and to an extent some Asian countries. But it didn't happen in a years, or I think in a very short term. Quite a bit of that, I think, emanates from the last crisis that we had during SARS, that is in 2003 space. Today, China is stronger in medical devices because of what happened maybe 15 to 20 years back, and of course, supported very capably by the government and the other initiatives which came along. This opportunity, perhaps even for India, brings in, I think, that playground, and I think government has done its bit in terms of making sure that there is Make in India program, and also there is a lot of impetus and a lot of support which has been given to indigenous manufacturers. While I think all that is good, I still feel that there would still be a lot of gap in terms of what it takes for a large organization in terms of R&D and quality systems to put in place over years, versus the small scale manufacturers, as well as companies partnering together with them on open source, I would say, technologies to bring up a very reliable solution. So I think only time would tell in terms of how much of that capability can be sustainable long term, and also quality approvable.
Yeah. Thanks so much for that, Shubhi. There's another question coming in from Kaushik. This is for Shalini. And I think the folks at Michael Page are also listening to this one. Do you feel expansion plans of businesses and manpower recruitment for the devices industry will be affected very much? And what could be the possible percentage?
So I think it is definitely going to get impacted because we are all taking a pause for a moment, trying to evaluate the business models, trying to see where do we want to put our workforce on, or which sectors do we want to concentrate more on. So I think there will be a definite pause. And this period, I think all business leaders are evaluating that where do we put our 20% of our resources to be able to deliver 80% of the results. So if you're trying to do that, by the time we come back to saying that this is what the new structure would look like, or this is what the new game plan would look like, it is some time away. So I think at least by the end of the year, we would not, come back by adding new, workforce to the system. We would evaluate because we also still don't know. And as to one of the poll questions, where do we start to think that this thing is going to go away? 6 months. Most people say 6 months to a year. So if that's the case, there's a whole lot of efficiencies to be built in before we start adding new people into the system.
Yeah, and perhaps being from the sector, I can throw in one question of my own there, Shalini. Do you foresee there'll be demands for any new skills or new functions or new kinds of people, given the change circumstances right now?
Yeah, I think there'll be a lot of new skills that will be required, especially at leadership level. We need people who are very, very agile and who are very resilient, who've experienced the changes and have been quickly able to themselves come out of that situation and bring the workforce and their organizations also into the realm of saying, let's innovate. Let's look at this problem differently. What can we gain out of it? So that is the kind of skill that we will require at leadership level. At the levels where people are at the healthcare workers and the other levels that we will require more of customer orientation. Bringing back to my previous point, saying if you are delivering to a customer, what is it that you can make yourself more customer orientation into your approach so that you are able to bring in more solid relationships where people keep coming back to you. Yeah. So it is a repeat customer or repeat patient that you will bring in that will be because of customer service and not just because of the technological prowess that we have.
Yeah, got it. Thanks.
Ankit,
yes, Shubhi.
Yeah. So I think very well said by Shalini. But if I look at how things are going to change in terms of capability requirement, when I evaluate the last 2-3 months, I can easily classify my team into two categories. One is doers, and the others who are waiting for instructions to be given to them. And in these times, and for that matter, any times, I would rather have a team member or an organization which is full of doers, self-driven people, innovative people who can think out of box, and at the same time are very, very quality in terms of their outputs, who are technologically savvy, who are digitally savvy, because these are times when you're talking about the new skills. Everyone is talking about digitization, or everyone is talking about AI, and everyone is talking about analytics, right? So if those guys have that skill, these guys would definitely be welcome in these organizations, and will also find ways and would find place in any organization, I would tend to believe. Yep. At the same time, I would think that if the organizations, especially in the medical devices, if they're not talking or thinking about their go-to-market strategy at this moment, especially in terms of e-commerce platform or maybe low-touch models of virtual pathways, I think it is time to start thinking on those lines, because some of the behavioral changes, whether it is doctors, whether it is patients, or whether it is even customers or any stakeholders, I think some of those changes that we are seeing on the behavioral level are here to stay. they're not going to go away in 1 or 2 quarters once the COVID situation is out. Obviously, we expect that the electives will go back, the patients will come back to the OPDs, but some of those behaviors will change. So definitely, I would look forward to people in my team who have those qualities. And in addition, I think I would definitely welcome those guys. In my marketing team, for sure, I would look at people who have experience of digital therapy, who can do, who can manage e-commerce platforms, who can do back-end IT support, whether in my team or elsewhere in the region, wherever. But I need those people as of today.
Okay, thank you. Some great inputs over there. The next question is a related one, and I think it is specifically addressed to Pavan. So I'll maybe go to a next question just to cover a different topic, and this I'll address to Dr. Shankar. COVID-19 has put the medtech industry at center stage. Most specialties such as orthopedic implants, lenses, catheters, etc., experience a strong short-term decline due to postponement of these procedures. So will high backlog of case volume make case coverage a challenge going forward?
No, I don't think it won't be a challenge. So most of the places had capacities to do extra work. So we will be able to cope up with the backlogs, and backlogs are not huge. It's almost 2 months only. Like I said, elective surgeries have started happening, even joint replacements. Some of the hospitals have started doing them. So shouldn't be a problem. Maybe this backlog of 60 days should be covered up in 2 to 3 weeks of time.
Okay. Okay. Thank you, Dr. Shankar. And there's another question which is, I think, best addressed to you. With low patient footfall, private hospitals may eventually face cash flow issues. It is likely that they will approach their suppliers, that is medical device manufacturers, for renegotiating prices downwards. With top lines already impacted, how can support functions proactively plan to contribute to the bottom line to accommodate such requests from customers of devices companies?
So I don't think cash flow should be taken a plea for negotiations. Negotiations we keep doing whole year. That's part and parcel of everyday's life. So in fact, to manage cash flows where we would need help from medtech industries is maybe medtech companies are more evolved, I would say, from a supply chain perspective. So that's where if they can pitch in and help hospitals, maybe in managing inventories better and maybe managing the overall situation in a better way, will help both the organization in the cash flow situation.
Okay, got it. So we have a few questions which we have covered to some extent. I'll move on to a slightly different one. How is the role of marketing going to evolve in utilizing multi-channel engagement to provide meaningful touch points for customers? And perhaps I can throw this up to both Pavan or Shubhi. Pavan, would you like to take this up?
Thanks, Ankit. Appreciate. I think we kind of probably underutilized marketing in what needed to be provided to customers in India. We kind of thought that marketing was more front-end activation because the technology was developed elsewhere. Here is when, for the first time, we will have a playbook or a palette where we can paint, meaning everybody is at the same stage of how do I digitize and become non-physical in reaching out to my customer. Across the world, we are making those transitions, and different businesses, different segments are at different levels. Researchers probably are more advanced. They use internet to buy, to search, and to decide, much more advanced. But patients are at the same stage, hospitals are at the same place, and channel is at the same place. So here is an opportunity for marketing to actually come up with what exactly is the strategy going forward now that we learned that a disruption like this could get us to a standstill. What is the level of in-person training Dr. Shankar talked about? Okay, we've been training nurses and other people using one-to-one, in-person, beam it up on a screen, give a dummy arm and train. That's not going to work probably effectively. It's not going to be the right optimal way. What can I do with virtual reality and augmented reality, and how do I do it? Resistance earlier saying, when you could do it for X rupees by coming into my hospital, why would I want to invest in a virtual reality set for say 2 lakh rupees? And now that you will not have that easily, the cost of managing infections is much higher. You would accept technology, which means there's a lot more you can do to bring in the right content.
Yep.
You would have a surgeon train 10 other surgeons, aspiring surgeons on a new technology, but now probably you would utilize technology to do that. So for a marketer, there is a plain Jane email campaign, or do I do a webinar, or do I do search engine optimization? Do I invest in e-commerce? Do I invest in patient connect communication apps?
Yep.
Or it's a combination of AI in your forecast planning, demand planning, or analytics of digital cytology going very digital, interpretation of cytology. We have no cytologists across the country. Can I then, do? So the role of a marketer is going to change from, hey, I wanted to do a small kickoff meeting or a launch of a program or run a market survey, to actually saying, what would my strategy of getting the best information from patient back to manufacturing, design of a product, and then enabling that. Market development in India, most of our practices are what we learned 30 years in our medical school, except for the corporate hospitals. Most of the med device industry has been partnering with hospitals in that journey. So that's the hardest one, where you'll have to figure out, we still are human beings. Behavior change will happen only with high touch.
Yep.
Technology is not going to change some deep-rooted behaviors. So we still have work to do there. If you discount that, there's a lot more a marketer can bring, as opposed to vanilla stuff we had done earlier. So I would say, start thinking about this.
Yep. Thank you. Shubhi, any other perspectives you want to add to that?
No, I think Pavan covered it very well. But I think I would throw in some interesting thoughts maybe for marketeers. And I keep throwing that because I think it is a perspective which needs to be brought in as well. We have been within the last 3 months, we've seen some of our very interesting surveys and analysis. I think one which comes to my mind is one which I saw in Bain recently, is about most likely between last quarter and this quarter, patients believe or consumers believe that they're going to probably increase by roughly about 20-25% in terms of their approach or their likelihood of trying telemedicine. Similar numbers for self-diagnosis, similar number for evaluating digital pathways or virtual pathways, as we say. And fourth is 20-25% or 30% people saying that they'll try out online pharmacy. So this is an increase over what was the number between this quarter and the last quarter. So that definitely is a shift. Now with these kind of behaviors, I know pharma is directly, I would say, more impacted than med devices. But if you actually equate with the fact that when you actually survey the doctors in terms of the COVID times and also beyond, how many of those doctors, whether it is a medical device guy or a pharma guy, how many of them are now willing to see a face-to-face pharma person versus they are open to not seeing them or seeing them virtually? I think there's a shift of I would say again, the numbers say from 45 to about 77%. So while 77% people, doctors used to would think that they would like to see a medical device person face to face, today the numbers are as little as 45%. Now, I'm not sure if that is going to stay forever. I'm sure it's going to come back to the normal 70-75%. But for sure, I think there would be a surge. Now, given these aspects, I think it is a food for thought for the marketeers to think about as to what would be their go-to-market strategy, whether it is in terms of improving diagnosis for your therapies or improving patient connect or patient pathways or even the user experience, whether it comes in terms of medical devices And similarly for, I think, your stakeholders, what would you really like to do, given the fact that you have a little more money to leverage, because all your in-person meetings, your CMEs, your CNPs, conferences are going to go down drastically. So, is there a thought process that you and your marketeers can challenge themselves on, that where are you going to likely to spend that money, that extra lever that you have? If your organization is giving you that chance to spend in the short term and the long term, where would you spend that money? If given a choice, I would tell my team to really go after any of these models, try experiment, or I would say innovation on any of these pathways and see where it takes you.
Okay, perfect. Thanks for that, Shubhi. Dr. Shankar, you want to come in on that one?
Yeah, I just had a suggestion for Shubhi, that money you can pass on as discounts.
That we anyway are prepared, Dr. Shankar, because we know for sure that it is not just us, but I think everyone, when I talk about industry in terms of our competitors, our peers, everyone would be very, very keen to recover their revenues, right? So there would be definitely pressures on profitability. What I'm trying to say is, whatever little spend that you have, you've got in terms of your SG&A spend on either travel or field events, I think that money, if that can be utilized by marketers on some innovative projects.
Yeah. And I think we are almost up. I have time for one final question, and I'll address this to Dr. Shankar, given that it's about cost, and there's also a streak of nationalism, I think, over here. So the medical devices sector has always struggled with availability of low-cost Chinese competitors. With the external circumstances and sentiments around China currently, do you feel that surgeons and patients would stop using low-cost Chinese medical devices? Or do you feel they would increase their use of the same due to issues around affordability and low cost?
I differ with the statement given in the question. I don't think surgeons or patients, I can't comment about patients, but yeah, at least for surgeons and hospitals, go for low-cost Chinese medical devices. Yes, they go for medical devices, Chinese, but low cost is, I don't think is the right word to be used over here right now, because end of the day, all these devices are meant for safety and maybe a faster recovery of the patient, and no doctor would like to compromise on that. Having said that, lot of European and US companies were getting their things manufactured in China. So the sentiments, I believe, are more political, and I think they are going to affect the Chinese market. I don't know. Pavan would be a better person to take over this and answer that.
Thank you. I'm always in support of you, sir. Don't ask for a discount. I feel that it is more that you got to see what is the quality, what is the product certification, regulatory pathways, what does it do, and what's the cost of poor quality if you were to choose a device. And it may be less about where it is manufactured. So there are a lot of times this thing happens that, oh, I don't want from China. But over a period, people accepted that it is not about made in China. It is about what are you actually giving. If you're going to say, I'm going to give you, I'm just making up something as an example. If you say that I'm going to give you a product X at 2,000 rupees and it's made in China versus, hey, the technology is available anywhere between 8,000 to 15,000 rupees. And it's made in China, there may be a better acceptance. It is just that if you were to say, I'll give you something which will stop working tomorrow, that's when the problem is. So I don't think there will be that much of a bias from a surgeon or a hospital evaluation. That's why it's a B2B business. They do a lot more evaluations on cost of poor quality outcomes and then decide, as opposed to where it could have an impact is when a tender clearly says it's L1 that matters, lowest cost that matters. There probably where usually government being that mindset or parameter, L1 happens, there may be a little bit of a change in their mindset saying, you want to have supply reliability, Atmanirbhar, Therefore, we don't want to let imports dictating that. That could impact some of the Asian countries, not necessarily only China.
Yeah, perfect. Thanks for that, Pavan. And I think we've had a great discussion today, some very frank, insightful, and at some points hard-hitting points came through in the discussion, which was great to see. So I would like to express my thanks to Pavan, Dr. Shankar, Shubhi, and Shalini. And I will pass over to Harit now for some closing comments. Over to you, Harit.
Thank you, Ankit. So a big thank you to all the attendees for joining in. I hope there was something useful for all of you to take back from the session today. However, if there are still any questions and queries, please feel free to reach out to your respective consultants or me for that matter, and we'll be happy to address your concerns or questions. Look forward to seeing all of you soon. Take care and stay safe. Bye-bye.
Thank you, everyone.
Thank
Have
you.
a good evening.
It was a pleasure. Yeah.
Thank you.
Thank you.
Thank you.